Hey, what's going on? This is Eric with Olympic Health Physics, and today we're going to be talking about notification values in CT. Welcome to this two-part video series where we're going to be talking about the AAPM recommendations for notification values and alert values for CT scanners to stay in compliance with XR25. We're going to be following in these videos, we're going to be following the AAPM recommendations, and I'm just going to be explaining to you what they're all about. So stick with us, and we're going to be going through the notification values first. So what exactly is a notification value, and how is that potentially different than an alert value? What exactly is a notification value? A notification value is a value that is going to be set at the series level within your exam that is going to notify you when you exceed that threshold for a particular series. The way that it does this is via a pop-up window to the technologist based on the pre-scan CTDI or the pre-scan DLP. That notification value is going to be triggered when any one of the series notification values is going to be exceeded or potentially be exceeded. Because the notification value is set on each series within a multi-series exam, it allows for each series within the exam to be independently evaluated to ensure that the dose that you're going to be delivering to the patient is actually the appropriate dose for that scan. What notification values don't do is account for the cumulative radiation dose that a patient will receive during the course of a particular CT exam, including all of the multiple series. That's going to be alert values, which we'll talk about in the next video of this video series. That's an important thing to remember, is that the notification values are going to be series dependent and do not account for the cumulative radiation dose that the patient may receive during a particular CT series. Let's say that you're scanning a patient. What happens, or what do you do if you exceed a notification value? Well, the first thing that's going to happen whenever the pre-scan CTDI is predicted to exceed a preset notification value in the scanner is a pop-up window is going to pop up and notify you that you may be exceeding a predetermined threshold for a series within that exam. So the first thing that you need to do is check your technique and check what you're doing to make sure that you actually intend to deliver a dose that's going to exceed the notification value. So look at your technique, look at your KV, look at your mass, make sure the patient is isocentered. All of the things that could affect dose, you want to verify that those are actually going to be accurate for the exam and the type of patient that you're imaging. The next thing that you want to do is you want to enter in a comment into the system. Most CT systems have the ability to do this, where you'll type in a comment explaining why the notification value is going to be exceeded. For example, if the patient is extremely kyphotic and you weren't able to completely isocenter the patient, make a note of that. If it's a very large patient and the mass is going to be really, really high because you have all of this additional tissue that you need to penetrate, make a note of that. And then that way, whenever the dose logs are pulled on the back end or reviewed on the back end, it makes sense on why the notification value was exceeded. The whole point of the notification values is to notify you before the exam is conducted to catch potential errors before they actually occur. So the notification values are there just to serve as reminders to verify that what you're doing is what you intend to do for the patient. The last part that I want to talk about with notification values is, where do you set your notification values? At what level do you set them for each series within a CT exam? Fortunately, the AAPM does have guidance on where those notification values should be set. When you're setting notification values, you want to be aware or cognizant of a few things. You want to make sure that the values are going to be low enough that we're able to catch outlier exams, but we also want to set them high enough that we don't lead to alert fatigue, where every exam we do, we're seeing notification values. We don't want that either, because if that were to happen, then as a technologist, you're going to go right through them really fast and not pay any attention. So we want to set them high enough that we don't end up with that alert fatigue. Here we have the notification value recommendations from the AAPM. You can set the notification value based on the scan region. So for example, for an adult head, notification value is 80 milligray. For an adult torso or body exam, 50 milligray, so on and so forth. So you can use this table as a reference. This comes from the AAPM, and we'll link to this in the description for the video. But this can be used as a reference for setting your own notification values on your CT scanners. That wraps up notification values and what they are, what the goal of them are, how to use them, what an appropriate setting is for your notification value, and what to do if you encounter a notification value. Stay tuned for next week's video, where we're going to be talking about alert values and how they differ from notification values. If you have questions about notification values or alert values for your CT scanner, feel free to reach out, drop us a line, and we'll be happy to help you out.